How do you spot your best and or your worst health plan? Ask these 3 questions and you got it in the bag. Question number 1 is, what do you need on your health plan? Now, to answer that, you're going to list out these following things. For each person that you want to have covered on the plan, what is their name, their age, their birth date, both, I promise. Then after that, for each, write down their medical needs. So we're talking prescriptions. What prescriptions are they taking and what are they taking it for? Then for each person, write down what their regular doctor visits are. Are the kids hitting their urgent care a couple times a year? Or does somebody have high blood pressure or thyroid and have to hit the doctor 2 to 4 times a year to have blood work done, etc.? And then how many times a year? Then write down, does anybody have any medical procedures or surgeries that they need in the next year? And then finally write down what doctors, hospitals, any particular labs that you want to make sure take your plan. These are the different things that you are going to need on your plan. So that's question number 1. Boom. Now question number 2, let's see what you have. This is your current health plan. Now, the first easiest way often is just pull out your medical card. On it, it should say the health insurance company, what type of plan it is, so HMO, PPO, etc. Then write down how much you pay monthly for your plan, and then who is all currently on the plan. Especially make note if the people that you want to cover on the future plan and who is on this current plan is different. Now, the second thing you want to answer as part of what do you have is we're going to look at the benefits, because we want to compare apples to oranges, not only for if you're wanting to go off this plan onto a new plan and make sure that it is better and or equitable to what you have now, or if there is a significant change, no matter what that change is, that you understand what it is and how it works. Now, the best way to get this information is going to be grabbing a summary of benefits. And what this is that if you don't have this currently, then to contact the health insurance company, phone number is usually on the back of your medical card, and just ask them for, hey, can you email me a summary of benefits? And what that is usually, it's like an Excel spreadsheet, and it lists out the different benefits that you have, from the deductible to your max out of pocket, any co-pays, and then your benefits. Like, do you have preventative? Do you have wellness? Do you have any limits on your plan? Like, it'll pay out $1 million within a year. And also if there's any specific benefits that are on it, say, does it have or not have mental health or pregnancy, things like that. So I definitely recommend calling up your insurance company and asking for that summary of benefits. And since you got them on the phone, ask for the full brochure as well. It's usually many, many pages long and has a lot of fine print, but you can have that in your back pocket just in case. Okay, now you know what your medical needs are that you need to have on the plan and what you've been using it for, or what you need to use it for, especially if you have a surgery or procedure, something that's coming up in the next year. And you have what plan you have right now, those benefits, what you're paying, who's it's covering, etc. Now we need to figure out, for the new plan that you're going to be looking for, what are your priorities? Now, what this means is, for example, are you really healthy and rarely go to the doctor and you're just really looking for that full catastrophic of like, hey, I'll take a high deductible, I can pay for it, not a problem, but if something major happens, I want to make sure that I don't lose my house? Or is it on the other side where, hey, I'd rather pay a higher premium for my plan now and then have a lower deductible, a lower max out of pocket. I want to have doctor visits and x-rays and labs paid for right out of the gate for me. I'd rather pay more now and not have to pay more later versus paying less now and then having to pay more later if something major did happen. Or is it somewhere in between? So think about that ahead of time, what's going to be the best for you. Now, besides premium, if you have any specific benefits that you want to make sure you have or you need for the year, then that is something that you definitely want to make sure to put high on your priority list. Not only that, are your doctors in network? Are the hospitals that you need in network? Is your specialist in network? Do they all take this plan that you are looking at? And along with that, last but not least, is out of network. What is the size of the network? Not only does your doctor or hospital take it, but do you travel a lot? Do you go out of state? Is one of your children in college in another state? If that's the case, then you want to make sure that you have coverage when you leave, or you at least understand what your coverage is or isn't once you cross state lines. Once you write that all down and get that into your mind and think about it, talk about it with your spouse, once you have that all in hand, you really can use that information to be able to spot the right health plan for you, but also, I think sometimes more importantly, spot the plan that isn't right for you. Watch that video now. I wish you joy and have a beautiful day.